Okay, so this is part 2 regarding our alterations in the integument. We ended the last slide regarding psoriasis and how psoriasis works, or how it develops. Pretty much it has that epidermal turnover going from 26 to 30 days to 3 to 4 days, so that's how fast the skin is growing with psoriasis and why we see those thick layers of epidermal thickening. So this is a picture of psoriasis that you may see. Some of your peers in class may even have psoriasis, which they can share with you if they feel like it. But this is a close-up of what one may look like. And you can see the extra thick layers of that skin and that it's not smooth and flat. It's kind of scaly and bumpy. So there are different types of psoriasis that you may come in contact with. There is inverse psoriasis, and pretty much with inverse psoriasis you're going to find this more in your armpits, the groin, under the breasts and body areas that are kind of subject to irritation from rubbing or sweating, just only because of the location where it's located at. It usually lacks the scale associated with plaque psoriasis due to the moist environment, and usually you'll see this more in people that are overweight or have deep skin folds. So it's kind of, like I said, it's very red and irritating. Usually they'll just treat it with some type of, they can use antifungal medications and things like that. There's also psoriasis that is called guttate. Psoriasis, it is a form of psoriasis that often starts usually in childhood or young adult, and it is probably the most common type of psoriasis that you are going to see. Most of these symptoms appear as small red separate spots on the skin, usually appear on the trunk and limbs, and not uncommonly numbered in the hundreds. I mean, there's just so many of them usually. Sometimes these lesions can form on the scalp, face, and ears. They're usually not as thick as the lesions that characterized by plaque psoriasis as well. So this form can precede or coexist with other forms of psoriasis, such as the plaque, though. And you can Google image these pictures so that you can see some of them and what they look like. I think I might have some on these future slides, but I'm not quite sure. I'm sorry, I apologize. But again, you can Google. Another type of psoriasis is pustular psoriasis. Now this one is characterized by white pustules surrounded by the red skin. The pus contains numerous white blood cells. It is not an infection, nor is it contagious, but that's what we usually see. Usually this is seen in adults. It may be localized to certain areas of the body, such as the hands or the feet, or it can be generalized, covering the entire body. But they do kind of go in a cycle where it's reddening of the skin, and then eventually you see pustules, and then you see scaling. And that's kind of what pustular psoriasis is. Now, erythrodermic psoriasis is particularly inflammatory forms of psoriasis that often affects most of the body surface. It may occur in association with another type of pustular psoriasis that you may see. It is the least common type of psoriasis and may occur once or more during a lifetime. It's very rare, maybe 1 to 2 people develop this type of psoriasis. Usually with this type of psoriasis, though, it's severe reddening and shedding of the skin over a large area of the body. Exfoliation often occurs in large sheets instead of small scales. So large sheet, like peeling of the skin when you get a sunburn, that big old peel. With this also, they become symptoms. Oh my goodness, tongue twister this morning. Anyway, where you will see patients with an increased heart rate as well. So we need to monitor our patients' heart rate as well as their body temperature. Because of the severe redness, the body temperature can elevate and as well as drop quickly on those hot and cold days. So usually when patients do have this type of a psoriasis because of the heart rate and body temperatures, it is pretty much an emergency where these patients need to go see the doctor immediately. It can be life-threatening with this type of psoriasis. So again, if we see anything like this, we need to make sure someone is notified about it. But those are pretty much your psoriasis of what you're going to see. This is an example that you may come in contact with. Well, I shouldn't say contact with, but what you may see for patients such as the guttate psoriasis is what this one looks more like. You also may come across some different types of skin disorders that are like this pityriasis rosea, which is benign, self-limiting inflammatory disorder. And when this comes out, it's usually in the winter months. You'll see some kind of a redness on the skin. And so usually they'll have a circular demarcated salmon pinkish type disorder. And that's what this slide, it's very hard to see in this slide, but in these arrows are pointing right exactly into the area of what is affected. So you can see the different color of skins on this type. There's also another papule squamous disorder that you may come in contact with called lichen planus. And this one's benign inflammatory disorder, unknown origin, but T cells, adhesion molecules, inflammatory cytokines, and antigens are present when we look into these. They are non-scaling, but they kind of look almost like a purplish light violet kind of color. And usually the most common locations is the wrist, ankles, lower legs, and genitalia. So this lichen planus, you can kind of see almost like a purplish color on top of these little papulosquamous disorders. Also, the common ones that we see, acne, we all, I hope, maybe some of you are lucky and never got acne, but I have and still do. And so acne is just an inflammatory disease of these sebaceous follicles. And we will see this type of papule squamous disorder, as well as acne rosacea, which is the kind that they claim I have since I'm an adult. But anyway, we'll go on from there. It's, of course, inflammatory. Oh, this is lupus. Sorry. Lupus we talked about briefly last week in another lecture. It is an autoimmune disorder. And usually you'll see these little redness butterfly pattern rash on the face. And that is called lupus erythematosus, where you see these this rash on the face. You can also see with lupus, they may have some of these little rashes on their arms, as you can see in this picture. Pemphigus is an interesting vascular disorder, not the papulosquamous, but this is now vasculobullous disorders. So pemphigus is rare. This one is where it's a blister-forming disorder in the skin or oral mucous membranes. It's an autoimmune disorder or disease caused by IgG antibodies, and these antibodies are against the cell surface. They adhere to molecules and are in the desmoglein in the suprabasal layer of the epidermis. Pemphigus is where if we do the tissue biopsy, we will see these IgGs. There's different types of pemphigus. The most severe is the pemphigus vulgaris. Bullous pemphigo is more benign disease than pemphigus vulgaris, but they do bound to IgG and blister in the subepidermal skin layer as well. So the subepidermal blistering and eosinophils is what distinguishes pemphigoid from pemphigus. So the two different types. They're kind of close but similar, but until we can do biopsies, we really can't distinguish exactly which one is which. So this is pemphigoid, and you can see the blisters, the pustules that are kind of forming in the body here. I'm not sure about this picture. It almost looks like it might be in the upper arm area, but I'm not quite sure. Another vasculobullous disorder is erythema multiforme, and this one's an acute recurring disorder of the skin and mucous membranes associated with allergic or toxic reactions to drugs or microorganisms. So one of the things that you may see is what's called an erythema multiforme that looks like a target or a bullseye. And that's where the erythematous regions are surrounded by rings of alternating edema and inflammation. So it looks almost like a target, um, actual target. So it can affect the mouth, the air passages, esophagus, urethra, and conjunctiva. So the most severe form of this is Stevens-Johnson syndrome, and I do not post a picture of this because it's really bad. So if you really like some gross stuff, go ahead and Google Stevens-Johnson syndrome with images, and you'll see some pretty gnarly stuff. But just warning you, it is not pleasant for the eyes. And I have taken care of patients with it, and it's pretty bad. Our body also obviously can have skin infections. We can have bacterial, fungal, viral, etc. But we're going to talk about some of the bacterial infections first. So, let's see here. Herpes. I don't want to go that far. I'm going to back up just a bit. Let's just talk about folliculitis first. That's inflammation of your hair follicles. The condition may occur anywhere on the skin with the exception, of course, your palms or soles of your feet. They may appear as red dots that come to white tips on the chest, back, and arms, kind of like an ingrown hair. Furuncles are most commonly caused by infection by the bacterium Staphylococcus aureus, resulting in pain, swollen areas in the skin that are accumulated with pus and dead tissue that you'll see with the furuncles. Carbuncles are individual furuncles, but they're just clustered together. So it's the same thing, but they just bunch of them grouped together. And cellulitis is a thing that we actually see a lot of in the hospital. It is localized or diffuse inflammation of connective tissue with severe inflammation of your dermal or subcutaneous layers of the skin. And I see these even as simple as a cat bite, and people need to come in and get taken care of with antibiotics when they have these infections. Another one is erysipelas, acute streptococcus bacterial infection of the upper dermis and superficial lymphatics. Patients typically develop symptoms including high fever, shaking, chills, fatigue, headache, vomiting, general illness within 48 hours of this initial infection. The skin lesion enlarges rapidly and has a sharply demarcated raised edge. It appears red, swollen, warm, hard, and painful rash, kind of consistent to what you would see. The skin would kind of look like an orange peel. More severe infections can result in vesicles, bullae, and petechiae with possible skin necrosis, as well as you may see some lymph node swelling, or what we call also lymphedema. So as well as you may see a red streak extending from the lymph node. So we want to kind of look at these rashes pretty closely. And impetigo is a very contagious bacterial skin infection. We see this more amongst our preschool children, and it is caused by Staphylococcus aureus as well. So let me show you some pictures here real quick. And then this is furuncle. And then, infections like herpes zoster and varicella are commonly known as shingles. It is a viral disease characterized by painful skin rashes with blisters in a limited area only on one side of the body. I have seen it stretch over to another side of the body, but that's very, very rare. But it's usually just one side of the body. It is caused by acute short-lived illness, chickenpox, which generally occurs in children and young adults. Once an episode of chickenpox has resolved, the virus is not eliminated from the body but can go on to cause shingles, an illness that we may see years later after initial infection. So if you've had chickenpox, you're probably at risk for shingles. They do have vaccines now, but they do not give those vaccines until you're over a certain age, I believe 60. And the reason why I asked a pharmacist about it one day, and that was just because they have not done the studies to see if it's helpful for the younger generation. So I'm going to stop this video here as well, and I will pick up on the, I believe, fungal infections for the next slides.